Community health centers that serve hundreds of thousands of low-income San Diegans are now dealing with millions of dollars in cuts. So far, they haven't had to reduce hours yet. 10 News consumer reporter John Horn explains why Congress today could help make sure that never happens.
Primary care, vaccinations, cancer screenings, and physicals. A lot of the money that helps keep those services affordable at community health centers like this one comes from Washington, D.C.
It's always full of people who are happy to be there.
And Giselle Brown says those very people inside La Maestra Community Health Center in City Heights help her live her best life.
Pap smear, mammogram, you know, they have a nice dental section in there.
The center's part of a network of 17 around Southern California that provide low-cost care subsidized in part with federal money. But those funds started to dry up at the end of September, and Congress hasn't renewed them. Now the centers are in a hiring freeze, and by January they may have to cut hours.
So we will pray that it won't.
The answer could become more clear today when the House votes on a bill that would fund community health centers nationwide for 2 more years. It has bipartisan support in the House, but Health Center Partners VP Vernita Todd says she's not sure it can get out of the Senate. Brown hopes it does, not just for her.
People would be left out. They wouldn't be getting the proper help.
But for her community. John Horn, 10 News.
Now, nationwide, the health centers get about $5 billion a year. About 70% of that is in jeopardy. On 10news.com, we have the directory of community health centers so you can find one in your area.